Friends, welcome to my channel. This video is important for all upcoming pharmacist exam and pharmacy exit exam. Question number first. Prolonged lithium therapy can causes option A diabetes mellitus, option B goiter, option C Parkinsonism, option D GOT. Correct answer is option B goiter. Lithium therapy can causes goiter and hyperthyroidism. Okay, and lithium medication commonly used to treat mood disorder like bipolar disorder. It can help protect against depression and reduce the risk of suicide. Lithium can accumulate in the thyroid gland at higher concentration than in plasma. This can cause the thyroid to produce and release hormones. Goiter can develop within a weeks of starting lithium therapy, but it can take months or years to be noticed. Next question. Drug effective in bipolar illness including the following except option A olanzapine, option B diazepam, option C sodium valproate, option D lamotrigine. Right answer is option B diazepam. Diazepam is a benzodiazepine medications. Okay, and olazapine belongs to the group of medicine called antipsychotic group, and sodium valproate used to treat epilepsy and bipolar disorder, and lamotrigine is used to treat epilepsy. Next question. Morphine analgesia differ from that produced by aspirin in the following respect. Option A, it has higher ceiling. Option B, it covers both prescriptions as well as psychic processing of the pain. Option C, visceral and ischemia pain is reduced better than somatic inflammatory pain. And option D, all of the above are correct. Right answer is option D, all of the above are correct. It has a higher ceiling, it covers both perception as well as the psychic processing of the pain, and visceral and ischemia pain is relieved better than somatic and inflammatory pain. Next question. Morphine produces analgesic by acting at option A peripheral pain receptor, option B a spinal site, option C sparse spinal site, option D both spinal and sparse spinal site. Right answer is option D, both spinal and spinal site. Morphine belongs to the group of called medication narcotic analgesic and used in severe pain. Next question. In man, sedation caused by morphine is characterized by option A little or no motor coordination, option B initial excitement, option C rise in seizure threshold, and option D all of the above. Right answer is option A little or no motor in coordinations. Next question. The subjective effect of morphine include the following except option A dysphoria in many urinated individual, option B euphoria in dependent subject, option C visual hallucinations, option D detachment of self and surrounding. Right answer is option C visual hallucinations. Next question. Action of morphine include the following except option A vasal stimulations, option B meiosis, option C antiemetics, option D postural hypotension. Right answer is option C antiemetics. Next question. Morphine include fall in blood pressure involve the following factor except option A direct cardiac depressions, option B direct reductions of vascular tone, option C vasomotor center depression, option D histamine release. Right answer is option A direct cardiac depression. Next question. Instead of depression, morphine stimulate option A vasomotor center, option B individual vestibular nucleus, option C temperature regulating center, option D cuff center. Right answer is option B. Next question. Morphine induced constipation involves the following mechanism except option A increase in tone and decrease in propulsive activity of intestinal muscles, option B anti-vasal action. Option C, spasm of gastrointestinal sphincters. Option D, reduction of gastrointestinal secretions. Right answer is option B, anti-vasal actions. Next question. Use of morphine in the following category of patient does not carry any special risk. Option A, ischemia heart disease patient. Option B, bronchial asthma patient. Option C, elderly male patients. And option D, biliary colic patient. Right answer is option A, ischemia heart disease patient. Next question. Morphine is contraindicated in head injury because it does not relieve in pain or head injury. Option B, it can raise intracranial tension. Option C, it can cause constipation. Option D, it is labeled to cause addictions. Right answer is option B, it can raise intracranial tension. Next question. Choose the correct statement about codeine. It has a lower oral penetrating activity ratio than morphine. Option B, it is devoid to abuse liability. Option C, it is weaker analgesic than morphine. And option D, it is more potent antitussive than morphine. Right answer is option C, it is weaker analgesic than morphine. The following is true of phenethidine except option A, at equivalent does it causes less respiratory depression than morphine. Option B, it is less constipating than morphine. Option C, it is poor antitussive. Option D, it overdose is often produce excitatory effect. Right answer is option A. Norphetadine, produced as a metabolite of pethidine, is responsible for the following effect. Option A, euphoria. Option B, excitement. Option C, analgesia. Option D, respiratory depression. Right answer is option B, excitement. Next question. The following opioid is more potent than morphine. Option A, pethidine. Option B, phenytoin. Option C, dextroprophene. Option D, tramadol. Right answer is option B. Next question. Indicate the opioid analgesic that is used as transdermal patches for chronic and cancer pain. Option A, morphine. Option B, phenazine. Option C, fentanyl. Option D, tramadol. Right answer is option C. Next question. The distinctive feature of methadone compared to morphine is option A, high oral bioavailability. Option B, high plasma protein and tissue binding. Option C, delayed and milder withdrawal symptoms in dependent subject. Option D, all of the above. Right answer is option D, all of the above. High oral bioavailability. Option B, high plasma protein tissue binding. Option C, delayed and milder withdrawal symptoms in dependent subject. The following opioid analgesic is similar to codeine in pharmacological profile but is less constipating. Select the analgesic and which act through opioids as well as additional spinal monomerasic mechanism. Option A, tramadol. Option B, Right answer is option A, tramadol.